Menopause is a normal part of aging, but the vasomotor symptoms, known as VMS or hot flashes, which many women experience, can severely impact their physical and emotional well-being. Despite this, a disconnect often exists between healthcare providers and patients, leaving women's healthcare needs unmet.
We conducted a national study to determine why this disconnect exists. We wanted to better understand the knowledge gaps and how this affects the care women receive.
Our study surveyed clinicians and interviewed those specializing in menopause care. These results expose some critical areas where medical education and practice could be improved.
Perhaps most surprising is the limited knowledge about vasomotor symptoms among OB/GYN residents, which could have long-term consequences for patient care. Further, our study highlights how these gaps have disproportionate impacts on women of color, compounding existing healthcare disparities.
There's also a concerning gap between what clinicians want to do for their patients and what they currently feel equipped to do. This means missed opportunities to discuss symptoms and offer the most effective treatments.
Our research revealed a lack of consistent evidence-based treatment approaches for vasomotor symptoms. There's also a need to address common patient misconceptions surrounding therapies and how they relate to their individual needs. It's time to clear up those misunderstandings.
This study underscores the urgent need to improve menopause-focused education across all healthcare fields. Medical training must start earlier, addressing vasomotor symptoms more comprehensively.
Healthcare providers require tools to understand how vasomotor symptoms uniquely affects different populations to ensure equity in care. It's also critical to empower clinicians to guide their patients through the wide range of treatment options from hormonal to newer non-hormonal therapy.